Good afternoon, everybody. So, thank you for joining me today. So, I'll introduce myself first. So, I'm Dr. Tan Hyang Ling, consultant endocrinologist in Lambai Hospital. So, I think it's just about 5 minutes past 3, so we'll make a start. So, World Diabetes Day is celebrated once a year, and this year it was on the 14th of November, last Sunday. So, the aim of this World Diabetes Day is to create diabetes awareness among the public. So the title of my talk today is Diabetes, Does It Matter? So the structure of my talk will be, only about 15 minutes, and this will be followed by the live Q&A session. So on the comment section, if you have any question, if you can write it down, and then I'll try to answer all the questions after my talk. So for the structure of my talk will be based on series of questions as well. So there will be 5 questions. That is the 5 questions. So the first one is, how common is diabetes in Malaysia? 2, do I have diabetes? 3, I do not have symptoms of diabetes, but should I still be tested for diabetes? 4, I have been diagnosed with diabetes, but does it matter? Do I need to take care of my diabetes, or is there a reason why we need to manage our diabetes as good as possible? And the last question is, does diabetes affect your lifespan? So we'll start with the first question. So you may already know the answer. So the first one is, how common is diabetes in Malaysia? So according to our 2019 National Health Survey, so up to 20% of our adult population have diabetes. And in other words, for every 5 adults, 1 will have diabetes. And what is this in comparison to the world population? So according to the International Diabetes Federation, the incidence of diabetes average is about 10%. So this means that if you compare Malaysia and the rest of the world, we are around double the incidence of diabetes. And if you look at this graph, so this is from the same survey the last 3 times, so 2011, 2015 and 2019, and you can see that year on year the incidence of diabetes is going up. And the main reason why this is happening is due to the obesity epidemic. So as a country, we are getting bigger. So this data is also from the same study from 2019. So 50% of adult population in Malaysia has a BMI of above 25, considered overweight or obese. And similarly, 50% of the adult population has abdominal obesity. And this is defined as a waist circumference in male of more than 35 inches and in female more than 31 inches. But the more alarming statistic from the same our National Health Survey is about 50% of those with diabetes do not know that they have it yet. So the first question tells us that diabetes is very common, is potentially underdiagnosed, and the incidence in our country is about twice compared to the world population. So that was the first question. So if we go on to the next question, so this is pretty much, if you don't do any tests, how do you know that you have diabetes? So we are going to discuss the common signs and symptoms of having diabetes. So one of the problems with diabetes is most patients at the early stage, when your blood sugar is not that high, you do not have symptoms. But that's the issue. So when you don't have symptoms, your blood sugar is already higher than normal, which means that it is already starting to cause problems. But when you have symptoms, it means that your blood sugar is now quite high. So the next few slides, I'll be explaining what are the symptoms that you may have if your blood sugar now is high. First, you feel very tired. Why is that? So when your blood sugar is high in your blood, your body is empty. So sugar is your main source of feel. So when you prick your finger, your blood sugar is high, it is all in the blood. Your body is empty, so you have no feel. So you feel very tired because everything of your feel energy source is in your blood. So you feel very tired. When you have excess blood sugar in it, what your body does is you will pee the excess blood sugar out. And when sugar goes, water goes. So which means that when your blood sugar is high, you will pass a lot of urine. And this is normally more noticeable at night. So you'll be waking up a lot at night to pass big amounts of urine. And because you are peeing so much, you feel very dehydrated. What next? So we know that if you have diabetes or high blood sugar, if you have any wound, it takes longer to heal. So this is just an example of a wound in your legs, but this can be wounds anywhere, not necessarily the legs. Similarly, if you have skin infection, we call it cellulitis, which is most commonly in your leg. This also means that you may have diabetes. So if you have a wound that takes longer to heal, or you have repeated episodes of skin infection, especially the leg, you may have diabetes. So you need to get tested. So if you remember, when you have excessive blood sugar in your blood, you will pee them out. So this becomes an area where germs and fungus will thrive. So this will lead to urine infection and vaginal thrush, fungal infection. So for those female that has repeated episodes of fungal infection and urine infection, you may have diabetes. So you need to get treated. If you don't get treated, all these episodes will be repeating itself. So vision. So we know that if your blood sugar is high, your vision can become blur. But your blood sugar improve, your vision will improve as well. However, if your eyes is exposed to prolonged many years of high blood sugar, it can cause permanent damage to your eyes. So some of our patients, they actually present first to the ophthalmologist with blurred vision and then diagnosed with diabetes. And normally, if you have eye-related damage due to diabetes, this normally indicates that you have diabetes for at least 5 to 10 years already without knowing. Finally, if your blood sugar is very high again, you will start to lose weight. So you remember from my first slide in the symptoms, when your blood sugar in the blood is very high, your body is empty. So your muscles, your fat will start to break down to provide fuel for your body. But the problem with this is this will be released into the blood and it will make your blood sugar even higher. So you will lose weight, and losing weight due to high blood sugar is very unhealthy and unsafe. So we've just gone through some of the signs and symptoms that may give you clues that you may have diabetes, but do remember, at the early stage, you do not have symptoms. So don't wait until you have symptoms before you get tested. So this is the third question in my so what if you do not have any of the symptoms that we have just discussed? Should you still get tested for diabetes? So the answer is yes. So especially if you have the following risk factor. So this is for those that you don't have symptoms, you feel very well in yourself, but if you are overweight. So we know that overweight is the main risk factor for developing type 2 diabetes. So if you're overweight, so you need to get tested for diabetes. Some of you may have a normal weight, but those that have done body composition tests where they measure the amount of body fat, so if you have high fat composition despite a normal weight, you are also at increased risk of diabetes. So fatty liver is a very common finding in health screening. Again, all these three, being overweight, high fat composition, fatty liver, means the same thing. You have a lot of fat internally, and all this will impair the function of your insulin, leading to diabetes. So this you cannot do anything about. So if you have a strong family history of diabetes, you are at higher risk. So you need to get tested. We know that as you grow older, your risk of diabetes goes up. So if you don't have any of the risk factors above, but you are above 40, you should start getting tested. Or you should start getting tested for diabetes earlier if you have the above risk factor, and definitely if you have any of the symptoms that we discussed previously. So some of you may already have diabetes, and you have heard of all the complications that it may happen if you do not take care of your diabetes. But some of you may not be sure why I need to take care of my diabetes, or why my doctor always asks me to make sure that my diabetes is well controlled. So there's a reason. So high blood sugar will affect nearly every single part of your body. So we'll go through one thing at a time. So first, we know about your vision. So diabetes is one of the main cause of blindness. So as we explained earlier, when your blood sugar is high, it can cause blurred vision, and when it improves, your vision gets better. But prolonged exposure to high blood sugar can cause permanent damage. So for those of you listening who already have diabetes, you need to get your eyes screened, and this can only be done through the ophthalmologist. They need to do assessment, including taking the picture from the back of the eye. And the reason why you need to get your eye screening is because there is effective treatment. So you do not want to wait until your vision is affected before you attend your eye screening. So prevention is always better. So we all know about stroke. So if you've got diabetes, your stroke risk increases as well. One of the main problems with stroke survivors is disability. So most will need help with day-to-day activity. For those of you who are listening now, do remember that if you get any slurring of your speech, difficulty in swallowing, if half of your body become weak or numb, this is a stroke, and this is a medical emergency, and you need to call ambulance straight away. Similarly, if you have the symptoms I've just described, but it goes away after a few minutes, this is called a mini stroke. All this means that the blood supply to your brain is not good already, which means, so mini stroke is telling you that you need to do something before you get a full-blown stroke. So we know about heart attack. So if you have diabetes, the risk of heart attack goes up as well. And in Malaysia, heart attack is the #1 cause of death in Malaysia. Again, for those who are listening to me right now, if at any point you get chest pain after you have a heavy meal, or you get chest pain after minimal exertion, and you get better after rest, this is what we call the medical term angina. Angina means that your blood supply to your heart is already not very good, and you need to do something now. You see your cardiologist or see your family doctor. So again, angina is a warning sign that if you don't do something now, this will lead to a full-blown heart attack. So we all know about kidneys. So a lot of my patients with diabetes, they're all afraid of kidney failure. So as part of our screening, as part of our diabetes check, we will need to check for 3 things. 1 is your kidney blood test. 2 is the percentage functioning of your kidneys. And 3rd, you need to do a urine analysis of how much protein leakage. So these three will form part and parcel of your diabetes screening for your kidneys. And if any of these is abnormal, we need to do something about it to prevent it from getting worse, leading to kidney failure. And we know that, again, diabetes is the #1 cause of kidney failure, needing dialysis or transplantation. Finally, feet. So feet is something that most of us, we don't really take care about our feet, but this is very important in patients with diabetes. So similar to stroke, where there is no blood supply to the brain, heart attack, not enough blood supply to the heart, similar, you can have no blood supply to your feet. So poor circulation to your legs. And so it doesn't just affect the circulation, diabetes can affect your nerves. So it can reduce sweating in your feet, making it very dry. When it is dry, it breaks. When it breaks, it can lead to an ulcer, and bacteria can go in. And the third picture is just pinned there, so it can affect your nerve, making your feet numb. So having a numb foot is not good. To the patient, it is fine, but actually it is not, because we want you to feel pain. Imagine you have a nail in your shoes without knowing, and a few days later, there's already a big hole in your feet. So sometimes some of patients, not here, so when I practice in UK, in the foot clinic, some of patients, they come in with a nail stuck in their feet because they have no sensation. So the combination of all this, if you have poor circulation to your legs, if your feet is very dry and you have no feeling, this can lead to a foot ulcer. So anybody with diabetes who is listening now, who has a foot ulcer, you don't wait. You need to see someone within 24 hours to get the appropriate treatment, because a foot ulcer that is not treated can lead to amputation. And the amputation normally will go from one toe, few toes, half of your feet, half of your leg, above knee amputation, and normally within 2 years you'll be getting amputation on the other foot as well. So very important, foot care. So foot care is very, very important in patients with diabetes. So we've just discussed the 5 major complications if your diabetes is not properly managed, from stroke to heart attack to blindness to kidney failure and amputation. So actually this is the last question. Does diabetes affect life expectancy? So does having diabetes reduce your lifespan? So this is a study published in the UK in 2015. So they assume, to make it simple, they assume that 60 years is your expected life expectancy. So if you have no diabetes, you live until 60 years old. But if you have diabetes, you take away 6 years of your life. If you have diabetes and heart attack, you take even more, 12 years of your life. So if you have diabetes, heart attack and stroke, you take even more, 15 years of your life. So ladies and gentlemen, so this is actually my last slide. My key messages from today's talk is mainly, it's very, very important to detect diabetes early. Don't wait until you have symptoms, and don't wait until you have complications. We know that most patients don't have symptoms at the early stage. Therefore, the only way to know if you have diabetes is to get tested. For those that already have diabetes, it's probably time to take control now. And it's very important to manage your diabetes as early as possible to reduce the risk of long-term complication. And it is never too late to take charge of your diabetes. So what our role is to educate you, give you the tools to manage your diabetes as good as possible, so that the important thing is you take charge of your diabetes. My role is to facilitate. So my last key message is you need to take action now. So that's actually the end of my talk. So as I said, it's only about 15 minutes. So we are going to look at any questions if there is, and then it will take about 5 minutes, and then I'll come back and we'll go through the questions on the Q&A session. Thank you. Okay, so there's a few questions actually. So I think there's 1, 2, 3, 4, 5. So there's 6 questions. I'll try to answer all of them. So I'll read out the question first. So first question is diabetes reversible? So I think the first thing is we probably be talking about type 2 diabetes. So the question is type 2 diabetes reversible? The answer is yes. So in the UK, one of the professors in Newcastle, Prof. Roy Taylor, has already done this research, type 2 diabetes reversibility. So what they found that patients who has diabetes and a lot of abdominal fat, they have a lot of fat around their liver, fatty liver, and around their pancreas. When they lose a significant amount of weight, their diabetes will go away. And when they repeat the scan afterward, all the fat around the liver and the pancreas has disappeared. And you may ask me how much weight on average you need to lose to reverse your diabetes. In that study, it was about 15 kilograms. And the earlier the diagnosis of diabetes, the higher chance of reversibility, called remission. And to add to that, so those patients in the research who has type 2 diabetes, they also have hypertension and high cholesterol. And in those patients that diabetes reverse, their blood pressure, cholesterol also gets better. So pretty much, if you ask me, type 2 diabetes, hypertension, and high cholesterol all can be reversed if you lose a significant amount of weight. So I hope that answers your question. So that's the first question. So the answer is yes, you can reverse your diabetes, you can reverse your blood pressure, and you can reverse your cholesterol, but it takes very, very hard work from the individual. The second question is, can we use any ointment for our dry feet? So the answer is yes. So if your feet is dry, you just need to make sure that it is a bit moist. But do remember, you shouldn't make your feet too moist because that will increase the risk of fungal infection. So if it's too dry, you make it a bit wet. If it's too wet, you make it dry. So any ointment, any brand, it doesn't matter. So any ointment that is suitable for you, you use it before and it makes your skin less dry, then it is suitable for you. So third question, what can type 1 diabetes patient do to prolong life expectancy? Okay. So if any of the audience has type 1 diabetes, so the first, this is for type 1, type 2, the most important thing is to get your control of your diabetes good as early as possible. We know that this is what we call metabolic memory. So if you take care of diabetes from the start, the body will remember. So if you ask me, good diabetes control, but do remember that when I say good diabetes control is the lower the HbA1c, the better, but not to the extent of repeated low blood sugar, because if you have repeated low blood sugar, it increases your risk of cardiovascular heart problems. So first is to make sure your diabetes is well controlled. Second, if you have high blood pressure, you need to get it under control. Third, if you have high cholesterol, you also need to get it under control. So all these three, whether it's type 1 diabetes or type 2 diabetes, high blood pressure, blood sugar control, high cholesterol, all will need to get under control to reduce your risk of heart attacks, stroke, blindness, and all the complications that we have just discussed. There is no specific medication to prolong anybody's life, but it's to control the individual component that is problematic. So the fourth question is medication necessary for pre-diabetes who are not overweight and lead a healthy lifestyle? So I guess if we put it in a different way, so if you have diabetes, my aim is to make you pre-diabetic. If you are pre-diabetic, my aim is to make you non-diabetic. So medication may not be necessary, but even at pre-diabetic, you are also at risk of getting any of the complications that diabetes have. So you ask me, lifestyle is, so coming back to the question, so if you're not overweight and you lead a healthy lifestyle, if you have pre-diabetes, you might want to check your body composition, because you may not be overweight, but you may have a lot of body fat, or the other thing that you may have is you may have actually type 1 diabetes. So you need to remember, so out of 10 patients with diabetes, 9 will have type 2 diabetes. And type 2 diabetes is due to high body fat composition. Type 1 diabetes is the minority, but they will need insulin. The only treatment is insulin. There's no other treatment. So for type 1 diabetes is because the body is not producing enough insulin. So the fifth question is, does overeating fiber and low carbo diet also cause diabetes? So it doesn't. So when we talk about carbohydrate like rice, noodles, breads, so all these are actually, when you eat, it is 100% sugar. So low carbo diet is actually one of the recommendation if you have diabetes. But remember, it is low carbo diet, not no carbos, because carbohydrate is your main source of fuel, so you always need some carbohydrate. In your question of overeating fiber, so I guess try not to overeat anything good. So anything good that you take too much is not good. So fiber is important, but overeating fiber is not good, but it doesn't, I don't think that can lead to diabetes. So I think this is the last question. So do you agree that school kids should be taught to eat right? Should the Ministry of Health intervene and provide free healthy meals for school children at school? The second question sounds a bit political, but the first question I can answer. So do you agree that school kids should be taught to eat right? So the answer is yes. Because if you eat right from the beginning, then you won't gain weight. And one of the problem is no activity or exercise is a big problem. So sedentary lifestyle is a big problem. Take away food, fast food is a problem. I'm not saying that you shouldn't eat any of those stuff, but everything needs to be in moderation. So yes, school kids, I think even before school, from kindergarten, kids should be taught what to eat and what is the correct food, what is the wrong food for general health. And one of the things that is not part and parcel of diabetes, but all of us normally do not drink enough water. So our body is 60 to 70% water, so you need to make sure that you have adequate hydration, and this will help it will help with those who are trying to lose weight. So at the moment, I think there's these are the 6 questions. I'm not too sure if there are any more questions. So if there are any more questions, so we can try to reply on the Facebook chat the next time. And all I want to say is thank you very much for tuning in, and I hope you have learned something from my talk, and have a good evening.